Have you ever woke up in the morning feeling a slight backache? Or just walked a few steps and your legs felt tired? Your knees felt like they were about to collapse? Do you think it's just a sign of aging? Maybe, but not enough. There's a truth that many people don't pay attention to. Your body may be lacking two very important nutrients. They are vitamin D and calcium. When lacking these two substances, your bones and joints will gradually weaken, silently, every day, causing pain, aches and pains, numbness in your legs, insomnia, and you don't understand why. And the dangerous thing is, it happens silently. No noise, no warning. Are you experiencing this feeling? Leave a comment below the video to share your story, because there are probably many people just like you. Now, let's learn more about the two silent friends of bones and joints, which are calcium and vitamin D. Imagine it like this. Calcium is like the sturdy bricks that help build the skeleton in your body. Each bone, each joint, needs calcium to stand firm. But if there are only bricks, but no one to put the bricks in the right place, will the house be stable? That's when vitamin D comes in. Vitamin D is the silent worker, helping transport calcium to the right place where your body needs it. If you lack vitamin D, no matter how much calcium you drink, it won't be absorbed. And if you lack calcium, then vitamin D has nothing to transport. Without one of these, your bones and joints will weaken day by day, silently, and you will feel it clearly, through every pain, every step. You see, our bones not only need age, but also need proper care from the inside. After understanding the important role of calcium and vitamin D, we need to face a truth. That is, the elderly are the group most likely to lack these two nutrients. Not because we do not take care of ourselves, but because our bodies over time have gradually changed. First, as we age, many people are less exposed to sunlight, staying indoors more, afraid to go out, afraid of the heat and clothing tightly when going out. But it is the early morning sunlight that is the natural source of raw materials that helps the body create vitamin D. No sun means lacking vitamin D, even if you eat well. Second, diets are becoming simpler: less meat, less fish, less vegetables. Some people eat poorly due to weak teeth. Some people lose their appetite or diet out of habit. Gradually, the meals are no longer nutritious as before. Calcium is also lacking. And finally, the most silent thing is, the body's ability to absorb decreases with age. That means, you can eat enough, take supplements, drink milk every day, but your body still cannot absorb it all. And the amount of calcium vitamin D is excreted without you knowing, causing you persistent back pain and sore knees every time you climb stairs, or even just a slight slip can break a bone. Many people only discover they have osteoporosis after a very slight fall. No pain at first, but then there are days of lying in one place and losing the ability to walk. You see, a lack of calcium and vitamin D in the elderly is not just a small matter. It is the main cause of weakened bones and joints, affecting the quality of life, and even threatening life when complications occur. If you, or someone you know, are feeling easily tired, unsteady on their feet, often numb in their limbs, or have had a minor fall that caused prolonged pain, please share in the comments section below. We are ready to listen and advise you. The worrying thing is, many people are lacking calcium and vitamin D without even knowing it, because this deficiency does not cause immediate severe pain. There are no obvious symptoms in the early stages. Silently, drains away bone health day by day, month by month. Your body is actually always sending out warning signals. You just need to pay a little attention. Do you often have cramps at night? Your legs suddenly twitch in the middle of your sleep? Even sharp pain that makes you have to sit up? Do you have a dull, persistent back pain? No heavy work, no falls, but your back is still tired, still aching every day? Do you feel you are getting shorter? Clothes that used to fit you now seem longer? Could be that your spine is slightly collapsing due to calcium loss. Have you ever had a minor fall, but then the pain lasted unusually long? All of these things are not random. They are whispers from your bones. When they are weak and need immediate attention, bones cannot speak, but your body always speaks if you listen closely enough. If those warning signs are ignored, if your body continues to lack calcium and vitamin D and is not properly supplemented, what will happen? The consequences will not come immediately, but it will be silent, quiet, and more dangerous than you think. The most dangerous is the silent osteoporosis, very common in the elderly. Osteoporosis does not cause obvious pain at first. It just makes the bones more brittle, weaker, and more prone to fracture. At that time, just a slight slip, a misstep on the stairs, or even sitting in the wrong position can cause you to break a bone. And you know, for the elderly, a broken bone is not just a physical pain. It also leads to a series of dangerous complications. Having to lie down for a long time, leading to skin ulcers, pneumonia, loss of ability to walk, dependence on relatives, depression, fatigue, gradual loss of joy in life. There are cases, after just a small fall, life changes completely. No more going to the market, no more playing with grandchildren, just hanging around in the room in bed, all just because of lack of calcium and vitamin D. A seemingly small thing, but the consequences are huge. We have talked a lot about the risks and consequences of calcium and vitamin D deficiency, but more importantly, how to prevent and improve early. And the good news is, you can start today, in a simple, natural, and safe way. No need for expensive drugs. No need for complicated supplements. Just a reasonable and nutritious diet. Calcium can be found in familiar everyday foods, sardines with bones, milk and dairy products, such as yogurt, cheese, eggs, especially the yolks, dark green vegetables such as spinach, kale, sesame seeds, small but surprisingly rich in calcium. In addition, don't forget, drink enough water every day. Water helps transport minerals to tissues in the body, including bones. And also avoid things that harm bones that few people pay attention to. Limit coffee consumption, because coffee causes calcium to be excreted faster. Stay away from carbonated soft drinks, because it reduces bone density over time. Like that, taking care of your bones does not require anything big. You just need to love yourself from small meals every day. Besides eating properly, there is a natural medicine that is both free and effective that you can use every day. That is morning sunlight. Many people often avoid the sun, fearing dark skin, fearing heat, but few people know that just 15 minutes of sunbathing every morning, between 6:30 and 8:30, your body can synthesize vitamin D on its own. Vitamin D from sunlight is the most easily absorbed and effective type, compared to external supplements. And when combined with light exercise, the effect is even better. No need to exercise heavily. No need to go to the gym. You just need to walk around the house, stretch your arms and legs, rotate your shoulders, rotate your neck, or practice simple movements such as stretching, deep breathing. A little bit every day, about 15 to 30 minutes. Regular, gentle. Your bones will become more flexible and stronger every day. And most importantly, you will feel healthier, sleep better, and feel happier and lighter. So, make sunlight and exercise an integral part of your joint care journey every day. A well-balanced diet, combined with sunlight and gentle exercise, is a very good foundation for protecting bones. But, in some cases, when the body absorbs poorly, or has difficulty eating enough nutrients every day, then supplementing with pills is necessary. In that case, your doctor may prescribe you to use calcium tablets, vitamin D, or some products that combine both. These products can effectively support maintaining bone density, preventing osteoporosis, especially in the elderly or postmenopausal people. However, please note the following important thing. Do not arbitrarily buy and take calcium vitamin D supplements without the guidance of a medical staff, because if you overdose, you may experience excess calcium in the blood, causing kidney stones, constipation, or heart rhythm disturbances. So, get checked out, get tested if necessary, and take the recommended dosage. Remember, the right time, the right way, the right dose is the safest and most sustainable way to care for your bones. Remember, health never waits for us. Every day that passes, your bones and joints are still silently changing. And if you don't start taking care of them today, then when you realize it, it may be too late. Taking care of your bones is not just to avoid pain, avoid disease, but you can walk gently every morning, sit and play with your grandchildren without fear of back pain, travel in old age without worrying about falling, and enjoy life to the fullest peacefully and healthily. Don't wait until you have to stay in one place, then regret not taking care of your bones and joints sooner. If you find this video useful, please share it with your loved ones who are entering their twilight years. Sometimes, just a short video can help someone avoid a fall or keep their feet steady with their children and grandchildren. And don't forget, subscribe to the channel to watch more useful videos about senior health, updated every week. Thank you for listening to the end. Wishing you good health, always healthy, peaceful, and happy with your family. See you in the next video.